Dr. Yogesh Taneja, Urologist and General Surgeon in Gurugram.
Hi, I am Satish Kumar Sinha. I am from Gurgaon, Sector 15, Part 1. I am aged around 71 years and a diabetic patient since last about 10 years. So I very often visit my regular consultant doctor, Dr. Avise Agrawal. So it is sometime in August 2021 when I started red chips when I used to pass urine. So I was little afraid. I waited for few days, it goes off, but again after 10 to 15 days it comes out, and gradually I found that my urine color changed to brownish. So next time when I visited my doctor, I asked him that this is what is my problem, and is it due to my this prolonged diabetes? Then he said, no, it has got nothing to do with that, but better you go take an ultrasound for lower abdomen. And I took the ultrasound, and after seeing that result, the ultrasound doctor mentioned about a small tumor inside my urine bladder. So Dr. Avise Agrawal also got suspicious. He said that you consult Dr. Indu Bansal, who is a cardiologist, and my wife also. So I consulted Dr. Indu. Dr. Indu diagnosed it as a tumor of approximately 1.5 centimeter big, and she suggested that I should go to some urologist for its removal, and it has to be done on urgent basis. She also recommended a hospital nearby, Jyoti Hospital, where she said that she can talk to doctor and I can get it operated there. But I consulted my other family members, my children, my son-in-law, my son. So everyone said that let us wait, let us find out a better doctor somewhere. And then due to some consultation on different forums and with many other patients, finally my son-in-law searched a doctor, Dr. Yogesh Taneja, who had a high recommendation from many other patients, and he was running a hospital, Siddhi Hospital, in Sector 46, Gurgaon. Sector 46, Gurgaon is close to my residence, so we planned for a visit to his hospital and take a preliminary idea and consultation from him. When I met Dr. Taneja, so after looking at that ultrasound report and Dr. Indu Bansal's recommendation and all, he said that he can operate my tumor, and tumor size is very big, so it has to be done very carefully. And he said that he will use the cystoscopy method, that is more or less a telescopic instrument which passes through your urinal passes and it has got a blade also which can cut the enlarged portion, and which can be, and after that it can be taken out through your urine pass. So after getting some little confidence from his these informations from him, I just asked him if this is painless process. He said that it is painless, and but will be conducted after doing the anesthesia. Then we agreed, and in September 21 he operated my tumor. Then tumor portion was sent for biopsy. As per normal procedure, it was sent for biopsy to Modern Diagnosis Center, and there they did the test and on the biopsy piece, but the result, they said that it is a very low grade migrant. That means that relieves a worry from all of us. Even the doctor was felt very worryless, because low migrant is something which is not dangerous. But doctor was not satisfied with only that result. So he also asked further from the Modern Diagnosis Center that how deep it has gone in the body. But on that the reply was from the Modern Diagnosis that it has not touched the bottom surface from where the tumor has come out. So the doctor said that, Dr. Taneja said that it has to be removed. It will be removed, and after that I will wait for few months, say, and then again I will do a cystoscopy. Then we agreed for that. The operation was done successfully. Doctor was very competent. I didn't feel any kind of pain or any other after effects of operation at all. Even the staff who assisted doctor during operation, or otherwise also in general staff at the Siddhi Sai hospital, was very cooperative, very knowledgeable, and all of them did a good thing for me so far as I feel. And the tumor was removed, and I was released from the hospital. Next day I was released. One day I was kept in the hospital. Next day I was released. Then again my appointment was after 3 months, when I next visited hospital after 3 months in December. Then cystoscopy was done. Cystoscopy is again the same process, but this time the blade is not inserted, but through a telescope sort of thing, you can doctor can see the condition where he has done the last surgery. And on that cystoscopy, few small tumors are also located surrounding that original tumor, big tumor which was removed. So doctor said that it is a reoccurrence of tumor. Means once one tumor is removed, there is a symptoms in some patients that the tumor keeps on occurring. So he said that we will have to remove these also. Looking to my last experience, I thought that it will be much easier, because this time tumors are very small, but they are quite means 7 to 8 tumors were there, small tumors. But with that experience, I immediately confirmed doctor that yes, let us do it. And next day he operated all the tumors, and that was in December 2021. Then the normal medicines were given to me for the operated portion to get better, and then again it was as last time it was done. Echoscopy was done after 3 months in March 2022, and then I didn't there was no further tumor located in my bladder. And I forgot to add that when my last surgery, second surgery was done, then again a biopsy piece was taken, and it was taken to a different diagnosis center this time, that is Narayana Hospital, and from where the doctor confirmed that it has got no malignancy. It is a clear piece of flesh, that's all. Even in the my first operation also, when I was operated first time, the biopsy piece was taken to modern diagnosis, and a re-checkup was also done through Narayana Hospital. And both the places, they said that it is low grade and it is not something which is dangerous. But anyway, that is a part of it. Now in March, when I got operated second time, third time, the echoscopy was done again, and this time no tumors were located. Then doctor says that since it is a case of reoccurrence, so better that we should go for a BCG therapy. I didn't know anything about BCG therapy. And BCG is something which is normally given for to children, BCG injection. So I was just aware of that. And that is something related to TB. So we could check. We means my family members, my son and other people. We also went through some different write-ups of doctors and other things on YouTube and other places. They all said that the BCG therapy is a procedure which is done to patients who has got a suspicion of cancer, and this is done in the very initial stage. Then I said, okay, let us do. Then doctor said that it has got a course. You have to, the medicine will be applied through injection. It will be again injected through your urine passes. And it is a very simple procedure. It can be done in daycare. You need not be admitted to hospital. So we can get it done, but it has got course. First initial 6 doses will be taken on weekly basis, and after that a gap of 3 to 4 months, again 3 doses will be taken, and then after gap of 6 months 3 doses will be taken. So this is the total course. But unfortunately, that BCG particular medicine, Cipla, that 8 mg BCG was not available anywhere. The doctor said that it is not available. We are trying, and we had to wait. But he gave us the name. You also try from your sources. Then finally, my son could be able to locate the source from where the BCG, this 8 mg of Cipla was made available. And that was sometimes in October. He could locate that, October 22, and then I approached doctor that we could manage to locate that medicine. So how many doses I had to procure? And he said, better you buy all the 6 doses. Or first initially you buy only 2 doses, because we have to see that your body accepts those. So instead of 2, I bought 3 doses, handed over to doctor. And when first dose was taken in September, no, not in September, in October. First dose was taken in October, and I didn't find any problem. Then I ordered for another 3 also. That was also made available, and that way the entire 6 doses of BCG injection, BCG therapy injection I have taken, and I have completed this course in last November, and this is January 2023, end January 2023. I don't find any problem at all in my body, either with my normal passage of urine or with this BCG therapy, any after effect, nothing is there. I am just leading a normal life, and that's all. I have full faith on my doctor, and the reason behind it is because I feel very safe in his hand. Otherwise, operation is something which can make anybody worry. Once a body is operated, then you can also find some other problem, also hidden problem, which crops up, and you have to go for some other treatment also. But in this case, this was not happened. Doctor was very experienced and very optimistic also about it. He said, Mr. Sinha, you don't worry, we will take care of everything. And it is true that he took care very well. And my first operation was done in Sai Siddhi hospital. Second operation was also done in Sai Siddhi hospital. But after that, the cystoscopy and the BCG therapy was done in Avise hospital, which is a super speciality hospital also run by this same doctor. And both the hospitals are very good, having good facilities, and I can vouch for it to any patient. I recommend, and I am very satisfied patient. Thank you. That's all.